Assalamu alaikum. I am going to talk to you today about immune defense, about the new coronavirus going around and what you can be doing, especially since it is definitely a world pandemic. You know, sometimes I do these Facebook Lives and I know that I have people from all over the world watching, right? And so I'm always cognizant of what we're doing in the United States, maybe different than what's going on in, Germany or different or what's going on in the Middle East. But now we are all kind of in the same boat with this pandemic. So today is March the 14th. It is the day after my born day. Yesterday was my birthday, as you may know, if you are following this page, because I put up, it's my birthday post. Like, how would you not know it was my birthday, right? So I had a wonderful, relaxing day. I went to the spa, do my skin look sparkly, got my facial done. And I really enjoyed myself. Alhamdulillah, I had a nice, relaxing day. And literally, that was the only thing I did. And then I came home and watched TV and took a nap or something. So, alhamdulillah. Thank you very much for the birthday wish. So, I wanted to really talk to you guys about things that we can do. Of course, we know. So, let me preface this is we know that this is a novel, meaning new virus. So there is nothing that we know for sure that is going to cure or prevent it. However, we do know things that we can do in order to keep our immune system strong. And that's number one that I want to talk to you about. Number two, I wanted to give you some tips and have you chime in on if you are in a place where you're avoiding going out, going to the store, going to the gym. Let's talk about what we can do in order to stay on our fitness goals. Or maybe you had planned on starting a fitness goal, but instead you're like, oh my gosh, I can't even get a gym membership now because I'm afraid I'm going to get corona, right? So what do we do in those instances? So let's start from number one. The novel coronavirus is a virus. It is novel, meaning that this particular strand of coronavirus, so coronaviruses are known inside of the animal kingdom. So we know that they are carried by canines, they are carried by bats, they're carried by different mammals, and there are different strains of them. So if you remember a few years ago, we had SARS, right? That was actually a strain of corona. This is a novel coronavirus. It's almost like something inside of a movie to me, because they talk about how it is a virus that is normally transferred between animal species, but it jumped to human. How many movies have we watched and this has happened? So it has jumped to human beings and it creates respiratory and flu-like symptoms. It is not the flu, guys. It is more contagious than the flu. It has a higher death rate than the flu. So don't take this like, oh, I'm just going to get a cold. Some people may experience very mild symptoms, but people that have what they call comorbidity diseases actually can die from it. So I'm one of those people where I really try to balance between making sure that I'm really informed so that I do not get paranoid. I don't know. Are you like that? A way that I calm my anxiety is to know as much as I can. It's for some people, knowing more makes them more anxious. I'm actually the opposite. I feel like if I know more, then I will know how to deal with it. Okay. And it's probably a part of my also type A personality that I feel like I can solve everything, right? Just give me the information. We'll figure out a solution. We don't know what it is, but we'll figure it out. So are you the type of person that you the more you don't want to know a lot, or you feel like you need to know a lot? We're in the age of information, and sometimes people are like, oh, give me more. And then some people's like, oh no, I just want to watch puppy videos because I don't want to think about it. Which camp are you in? I need to know. I am definitely I need to know more, because if I know more, then I know that I can take action. So what we know so far about the novel coronavirus is that it's a virus. It's a new virus, meaning a new strain of corona. It creates respiratory problems. So its symptoms are coughing, a high fever, and shortness of breath. From the initial autopsies of people who have died from corona, they have found that it creates lesions on the lungs. So that's one of the reasons why people actually die from it. They die from the respiratory part of it. So all of these things are really important to know, because if we know, like, hey, it is a virus, then the scientists has an idea, okay, we know that these things kill viruses. We know, as opposed to if it was a bacteria, we know that these things kill bacteria. It's a way for you to approach it. So as lay people, right, we're not in the lab trying to figure out how to cure this thing. What is the things that we can do? Now, I'm just going to give you a really quick reminder speech about washing your hands, disinfectant, doing social distancing. We keep hearing this, but it's so important that we do it. Wash your hands doesn't mean, and I'm going to say this because this is the Fit Muslima page, it is not wudu. Okay? We don't use soap when we make wudu. Wash your hands, dude. Okay? With some soap before you make wudu. So this is a new habit that I would say that I just started too, is because I realize, like, if I'm coming in from outside running errands or whatever, you don't have to necessarily be touching people, just touching the door or exchanging money, or, I'm really cognizant of all of the ways in which we pick up germs and bacteria. So my first inclination was, hey, you know what? Instead of using any cash, I'm going to make sure I just use my card, because that is actually going to cut down on the amount of things that I'm touching. And then I realized that when I go to swipe my card, I hold the card swiper still, and I'm like, darn it, that's germs. So little things like that, like, you become cognizant of. So being conscious of all of the things that you're touching, and coming home and washing your hands. Wash your hands. So this is something that's specifically for Muslims. Please wash your hands with soap before you make wudu. Because if you have germs on your hand and you're putting water in your hand and then just putting it in your mouth, you're literally just like eating the germs. All right? So water alone does not kill viruses. You need soap. Soap and water on the hands, 2 full minutes, not a 1, 2. It's not, washing your hands is not like making wudu. It's not 1, 2, 3, 1, 2, 3, right? Wash back of your hands, fingers, fingertips. You need to sing the happy birthday song twice, say your ABCs twice. That's how long you should be washing your hands for. That's number 1. Second thing, social distancing. This has been the hardest, particularly for the Muslim community. I'm sure other communities are having issues too, is because Juma has been canceled in many instances. So far, I've learned about 4 masjids in my state have literally canceled Juma and Salats, just so that the virus does not spread. The issue for social distancing, the reason why here in my city in particular, all of the schools have been suspended indefinitely. So parents that have kids in school cannot send them to school. This is not just so that, the surfaces can be cleaned down and then the kids can come back. It's because the virus is contagious within a 6-foot parameter of someone who is sick. So if you have one person that is sick and they sneeze, they cough, they're breathing, and there's moisture when people are breathing, they breathe out moisture and germs are attached to that moisture, you have a chance of catching it because you are within a 6-foot parameter. So that's the reasoning behind canceling schools, making jobs go virtual so that they can avoid people interacting in that way. This does not work if you say, hey, I don't have to be at work, so let's get 20 kids together for a play date. It defeats the whole purpose of the schools being canceled. Well, I think that me and my girlfriends are going to have a party because none of us have to work tomorrow. that defeats the whole purpose of the social distancing. So please be cognizant of the reason why people are doing this. Here in the United States, so far, we are not to the point where we are required to stay in our homes as they are in Italy. So in Italy, they waited too long. So the experts say that they waited too long to implement these things. And so now they're in a position where people have to literally just stay in their homes, right? So at least we can still go out if we need to and things like that. So now, I'm sure you've probably heard that other places. What you are probably tuning in is, what do I do now? Okay, so we want to make sure that our immune system stays as high as it possibly can, because if you are exposed to the virus, remember, the contagion is not every single person that touches somebody that has corona is going to get it. It is a percentage of those people. So how do you avoid being a percentage of those people? Health means that not just the absence of disease, your health is also defined by your ability to fight off toxins and invaders, right? How strong your immune system is. Somebody can not have any existing diseases, but then as soon as they come in contact with a virus or bacteria, they get sick. Right? Have you ever, and I've had these seasons in my life where I'm like perfectly healthy, but I get the flu twice in 1 year, right? You've ever been like in that space? Like, I don't have any health problems, but I just keep getting sick, right? So that is a lowered immune system. You want to make sure that particularly during this time, I'm in my house, that's why I'm doing this. I'm trying to be conscious of not touching my face, but it's really habitual. I gotta really be conscious of it. And I haven't went anywhere today, right? This is my birthday weekend. Remember, I'm relaxing. I haven't gone anywhere. All I did was do some clothes and relax and watch a little TV and come here and talk to you guys. So what you want to do is you want to make sure that if you do come in contact with a virus like corona or even the flu, that your immune system is built up enough that it can fight against it. So there's some things that we can do in particular. So the first thing is, don't freak out. This is so important. So we're going to talk about food and we're going to talk about vitamins, all the other stuff, but I think that this is really important. Stress lowers the immune system. And it's really hard right now because we're all kind of like a little bit on edge if you're not totally freaking out altogether. But stress lowers the immune system. Anytime your cortisol level rises, it tanks your immune system. So the best thing for you to do right now is really try not to stress out about it. Take the steps that you have to take in order for you to protect yourself and your family, and then you have to leave the rest to Allah. As long as we know that in Islam, Rasulullah sallallahu alaihi wasallam, he said, trust in Allah and keep your camel tied, right? So a man came to the Prophet sallallahu alaihi wasallam and he had a camel, right? And normally when they come inside the masjid, they tie their camel. That's their means of transportation. Think of it as kind of like, should I lock my car? And he asked the Prophet, what should I do? Should I just trust in Allah and then, not tie my camel and risk that he's going to run off? And the Prophet ﷺ, he said, trust in Allah and keep your camel tied. So that means that we have to do everything in our physical capacity in order to protect ourselves, and then we leave the rest to Allah, right? So you don't just like, hey, I'm gonna just not wash my hands because, I'm good, I trust in Allah. Oh, I'm just gonna, I'm going to a party or to the museum or to these places that have lots and lots of people around because I'm not afraid because I trust in Allah. No, you have to keep your camel tied. You have to do everything in your capacity to do, and you trust in Allah at the same time, right? So keeping your stress level down. Do what you have to do. Be confident that you're doing what you have to do. And then that is going to keep your stress level down. A second way for you to reduce your stress is this is a good time for you to start a gratitude journal, right? So there's lots of research that actually shows that keeping a journal, a gratitude journal in particular, really helps to increase the immune system. So I'll tell you about one research study in particular, right? So they actually did a study with people who were HIV positive. And they had one group to keep a journal, and it was a journal that they simply wrote down everything, both good and bad, that happened throughout their day, right? Then they had another group. Their instructions were to keep a journal, and they just were to write down the things that they were grateful for throughout the day. They tested their T cells, right? The cells that shows us how well your immune system is fighting off viruses, bacteria, and toxins. At the beginning of the research study, they tested both groups at the end of the research study. The group that wrote down the gratitude journal, they had a much higher T cell count than people who just journaled what they did throughout the day, because it was both good and bad things. So keep a gratitude journal. These are the things that are actually going to help you decrease your stress, increase your immune system. Yes, Nesma, I'm going to get to vitamins and foods, but I have several things that I wanna really emphasize, because I know that we are whole creatures. And it's not just about the foods we eat. It's about what we're thinking in our mind. It's about what we're putting inside of our body. And it's about how we're moving our body. Those are three things that I really try to emphasize when we talk about health and wellness. So when we talk about the mind, your first task is to decrease the amount of stress. If you have kids home that you're not used to being home all day, you're kind of used to sending them to the school, this may be a good time for you to create a really good schedule, right? Create a schedule for your kids. Make sure that you are doing it in a way that is going to help to decrease your stress during the day, especially if you have a lot of little kids, right? Don't just let them go wild. You have to have a plan. I say that. So that's the first thing. Different ways for you to decrease your stress. Make sure that you're still trying to get some exercise in. Super important. People who are active, who stay moving, people who exercise, they have higher immune systems than people who do not. They are more readily able to fight off germs and bacteria. That is super important. So, what is the things that you should be adding to your diet now that is going to keep your immune system up, right? First, let's talk about the things that you should not be adding to your diet, right? Do not use this as an opportunity to say, oh my God, I'm so stressed, I'm so worried, I'm going to eat ice cream and cake and candy and all this other stuff. Don't do it. The sugar lowers the immune system, right? This is the worst time for you to stress eat. This is time for you to really have some self-control and make sure that you are choosing healthful items. This is not the time to stress eat. Sugar lowers the immune system. So be very cognizant of the amount of sugar that you are eating at this time. Now, the good news is that if you are practicing social distancing and if you are going pre-shopping, you're not going into the store every single day being tempted by the candy inside of the cashier's aisle. So that's less temptation. So don't get that stuff and bring it home and say, I'm just stocking it for later. Just don't get it so you don't have it in your house and you don't have to worry about it. When it comes to things that you should eat, garlic, onions, both of those things have been shown. Those are called allium vegetables, and they have both been shown to help to boost the immune system. Try to use it as a base of everything that you cook, right? If you're going to cook some chili, if you're going to cook some curry, if you're going to cook some greens, put in the garlic, put in the onion. Fresh is always best. Make sure that you're adding those things. Turmeric, garlic, onion, turmeric. Those are my three favorites. Now, there are lots of different spices that can really help with boosting your immune system, but those are kind of like the 3 stars: garlic, onion, and turmeric. Those are the 3 stars. So garlic and onion is the allium vegetables, turmeric. And when you use turmeric, use fresh, use powdered. Put it in stuff that you may not have done before. So I normally don't put it inside of my collard greens. I now put it inside of my collard greens. I think that it's, one, it tastes really good. And number 2, Every place that you can get a little bit of boost is going to be helpful. So those are things. The third, so when we talk about foods, okay, let's finish foods before we go to vitamins. Lots of dark leafy greens. This is not the time to skimp on your vegetables. Fresh is best, but you should not have to just go to the store because all I can eat is fresh vegetables. Frozen is fine. It is very little nutrient difference, if any, between fresh and frozen vegetables, right? We like fresh because, one, they're going to taste better. Number two, the vitamins are right there and they're ready to be absorbed and it's easier to cook. But research shows that things like broccoli and greens and carrots and squash, the nutrient value of it changes very little, if any, many of them not at all, between fresh and frozen, particularly if it's done correctly. So if you're, getting it from the store, if you're doing it for yourself, remember flash freezing techniques is you don't want to fully cook the vegetable before you freeze it, right? You just want to put it in some hot water for a couple second dip, take it out, let it cool, and then freeze it because it will finish cooking when it's unfrozen and you're cooking it with your meal. So when you go to the store to stock up, get vegetables. Get your frozen vegetables so that you can have them and they are readily available for you. So we talked about increasing the amount of onions, garlic, turmeric, lots of vegetables, all types of vegetables, right? Don't limit to one or two. Get as many vegetables as you can. Make them the mainstay of your meals. Super, super important. When we are talking about vitamins, the key vitamin that you actually really need to increase is zinc. A lot of people think that it is vitamin C and they think that, I'm going to get vitamin C tablets and I'm going to take the tablets. Research shows that vitamin C tablets actually don't do much for you. Vitamin C supplements, rather, don't do much for you in reducing the amount of colds that you get or flu or reducing the duration of it. However, research shows that zinc can both reduce the frequency that people get sick with colds and flu, which is different than corona, but I'm going to talk about that in a minute. It can reduce the frequency as well as the duration and the severity of the symptoms. So you want zinc supplements, but don't go overboard with zinc supplements because the recommended dosage is between 15 to 25 grams a day. If you take too much, it can actually have the opposite effect. So more is not better. You want zinc supplements. You want to take between 15 and 25 grams a day. Research shows that can actually reduce the frequency of colds and flu, shorten the duration of them and the severity of symptoms. Coronavirus is not the flu. It is not a cold, okay? So what we know about the coronavirus is that it is a virus. And so now we have to start making conjectures between how our body fights viruses in general versus how they, for example, fight bacteria. So the old adage, I guess this is more than just in America. We have an old wise tale that says starve a fever, feed a cold, right? And so researchers actually did research to see if this is actually true, right? Why did, our great grandparents come up with this idea that if you have a fever, you should starve it. If you have a cold, that you should feed it. Well, we know that when a fever presents itself, it is generally a virus. So we get sick from two ways, well, more than two ways, but for these purposes, we can either get a virus or you can have an overgrowth of bacteria. When you have a cold, you're talking about stuffy nose, runny nose, sneezing, coughing. then we know that the cold, so that's the difference between having a cold and having influenza, right? That's also a virus. Influenza is over here. It's a virus like coronavirus. A cold is bacteria. So we know that viruses, so what they did was they actually took mice. We always experiment on mice. We would like to thank their species for their contribution to the human health and wellness research. Okay. But they are the closest thing that the experiments on mice closely translate to what they'll do in humans. So we would like to thank mice for their contribution and their sacrifice. So they took mice and they actually gave them a virus and they made them fast, right? To see if the virus responded to the fasting versus giving mice a virus and then feeding them a regular diet. And they found that the mice who fasted, who they did not feed, actually created more antibodies and killed the virus and recovered from the virus. The mice who they were feeding did not. The virus actually survived. So that actually proved that old adage is that fasting kills viruses. When you are feeding them, when you are eating, it actually feeds and gives them strength. So that's the beautiful thing. Ramadan is about to come, so hopefully it will help. So an additional research study that was actually just released in November of 2019 in a journal of immunology showed that being in a state of ketosis actually trapped the virus and expelled it out of the body. So here is almost like a second level of showing us, okay, fasting actually kills a virus, but how does it do it? And this was really groundbreaking. And I say that if it's confusing you between fasting and I just said ketosis, is that when you are fasting, your body actually enters into the state of ketosis. And I wrote an article about this. You can actually go to my blog, fitmuslimah.com is the blog. And the article, or you can Google it on Facebook. I put it on Facebook as well. Can keto, I think the title of it is, Can Keto Help Treat Coronavirus? I think that's what I titled it. So what the research shows, just as a point of reference, how it relates to the previous study that I just mentioned, is that when you are fasting, your body enters into a state of ketosis. Ketosis is a metabolic reset. So instead of you using glucose in order to give yourself energy, your body is actually using fat, converting it into ketones, and go into a state of ketosis. Get it? Ketones, ketosis. When your body uses ketones, you are in ketosis. Ketosis is when you are get your energy source from fat. This particular research study showed that when a person is in this, let me not say person, because I think they also did this on mice. I'll tell you, we love mice. You got to love mice. Don't kill them. Just trap them and let them go out in the field, because they really do a good service to humanity. What they found was the state of ketosis actually activated a gamma cell. And what this cell did was it created mucus, literally surrounded and trapped the virus, and then took the virus out of the body. This is significant because, and again, I'm not saying it's the cure to corona. I'm just saying it shows how we can fight against viruses as a whole. So what I would recommend in light of this study is don't sit around the house eating all day. Really use this time to practice intermittent fasting. Make up your fast from Ramadan if you need to. Just make sure that you are spending some part of your day inside of a fasting state. Fasting is technically going more than 12 hours. Anything less than 12 hours is not fasting. But go for it. Generally, people don't have a problem doing 16 hours. Go 18, go 20, whatever works for you. But I encourage you to use this time to really, focus on doing those things that are going to help you to keep your immune system, that's going to boost your immune system, that's going to help you fight off the virus if you come in contact with it. Experts say that millions more people are going to get sick before we can say that this is behind us. Many of those people are not going to die from it, but the problem is that even if you have it and you have very little symptoms, you can pass it to somebody who will die from it. So this is not about, oh my God, everybody's going to die. This is really about us trying to protect the most vulnerable people in our societies, which includes, for this particular virus, people who are elderly, have a very high mortality rate if they are exposed to this virus, high relative to the other population, relative to children. There aren't a lot of children. Children are actually able to fight this off really well. If you have high blood pressure, somebody with high blood pressure, that is a risk factor for this virus. The initial autopsy reports coming out of China shows that half the people who died, they did 170 autopsies. Half of them, that's a significant number, had high blood pressure. High blood pressure is a significant, we don't, again, this is a novel virus. We don't know why people with high blood pressure are more likely to die from the virus, but it's just something that we know now. If you have diabetes, again, it is a metabolic disease. It compromises your immune system. That is a risk factor for this disease. If you have any immune disease, any autoimmune disease, if you have cancer, or you're recovering from cancer, you have a low-grade cancer, anything that compromises the immune system, if you have any existing diseases, these are the people that we're trying to protect. So, if you are healthy, you have no comorbidity issues, be grateful, say alhamdulillah, and then take your role in protecting the people who may have a higher risk than you, right? This is not about you. It is about us as a community, us as a human family, of taking care of one another. And the way that we do that is making sure that we're not just protecting ourselves through all the things that we mentioned, making sure that we are washing our hands, that we're practicing social distancing, that we're eating lots of those good foods that I mentioned, that we're, taking our zinc supplements, that we're making sure that we stay active and we're eating vegetables, and not just doing those things, but also being cognizant of how we are affecting one another. All right, that is all I have for you today. Inshallah, tomorrow I will come on and I will speak to you a little bit more about really specifics on how to stick to your fitness goals during this time. So I'm debating if I'm going to go back to the gym for about a month. Now, I'm fortunate. I have an entire private personal training studio right in my backyard, literally. And I know everybody don't have privy to that, but you don't need all of that. All you need is a 6-foot space inside of your living room or your bedroom, and you can stick to your fitness goals and smash them. So we're going to talk about that tomorrow. So make sure that you like the page, follow the page, get notifications. That should give you some type of thing that says, hey, do you want to get notified when this page go live? Go ahead and get notified, because tomorrow we're going to talk about how to stick to your fitness goals if you are trying to avoid going to the gym. All right. Assalamu alaikum.